scale is something that has got a range of 0 to 14. And this is a scale that is used to measure the acidity or alkalinity of any liquid or fluid or any substance. So anything below 7 is called as acidic, and anything above 7 is called as alkaline. Okay. Now, our body, our blood has got a pH. Okay. And the normal pH of our blood ranges somewhere between 7.35 to 7.45. Anything above this range or anything below this range could be really deadly. Okay. So our body maintains this narrow range of pH of our blood, and that's where we remain at optimal health. Okay. So that's about the pH scale. Now, here's the true definition of health. Okay. Um, Please do pay close attention to this definition of health. You may not have come across this definition of health anywhere. Health is a state of good reserve of antioxidants. Disease is a state of profound oxidative stress. Now, let me read it again. Health is a state of good reserve of antioxidant. Health is a state of good reserve of not protein, not fatty acid, not omega-3 fatty acid, or not iron, not vitamin C. Health is a state of what? Good reserve of what is called as antioxidants. And disease is a state of profound oxidative stress. So we have two things here. One is antioxidants, and another one is oxidative stress. Okay, so that's the definition of health. Something that most of us haven't come across. So antioxidants on one side and oxidants on the other side. So it's a health is a perfect balance between these two important things. So in fact, I would say health is a state of slight tilt towards the antioxidant side. So you have more of antioxidants and less of the oxidants in your body. So that is where your health is going to be optimal. You're just going to experience supreme health. Okay. So now let's find out what is this oxidative stress and what is antioxidants. Okay, when I give you a definition, you need to understand what exactly is this oxidative stress and what exactly is the antioxidant. I don't want you to be confused with these medical terminologies. So now there's something called as oxidants. Oxidants are always something that destroys or damages your health. Okay. Oxidants are always something that destroys or damages your health. You may have come across this term called as the free radicals, but we have not actually, had a clear understanding what exactly this free radical is. In other words, I would call this oxidants and free radicals as something that steals a lot of the good things from our body. So may I request all of you to mute your microphone? Can you please mute your microphone? As I'm on full screen, I'm not able to see the option to mute you all. So let me request all of you to mute your microphone. Anita, if you can, please mute all. Thanks. So we have the oxidants or free radicals, which are destroying our health or something that steals what is called as the electrons from our body, which results in damage to our health, damage to our body. So as a result of increased oxidants in our body, as we just keep getting more and more oxidants into our body, in a moment, I'm just going to explain what are these oxidants that we get on a daily routine. You will have a clear understanding. But as we just keep getting these oxidants on a daily basis, what happens is that there's a kind of stress that increases in our body, what we call as the oxidative stress. Okay, oxidative stress. And what happens following the oxidative stress is something called as blood sludging. Blood sludging. In other words, it is called as your blood becoming extremely acidic. Now, you know the normal pH of your blood, but here, as a result of these oxidants coming in large amount, you have your blood turning acidic. Okay. And then what happens is something called as oxidative damage. Oxidants causing oxidative stress, acidic pH of the blood, and then it results in oxidative damage to all the cells of our body, or most of the cells of our body. So what happens is that this is where you end up with what is called as a disease. In other words, we call this as degenerative change. There are people who suffer from osteoarthritis of the knee, people who suffer from degenerative changes of their brain, like Alzheimer's, dementia, even stroke, and so many problems like that. And diabetes is a degenerative disease. And pretty much all of the diseases that we know of do have one or other form of degenerative change in them. So all of these diseases that we know have a preceding factor, which is oxidative stress. Okay, what causes the oxidative stress is the oxidants. So as a result of oxidative damage, we end up with degeneration, disease, and a premature death. Now let's take a look at what exactly is the antioxidants. Now antioxidants are something just the opposite of oxidants. So we know oxidants, something that's against oxidants, is what we call as antioxidants. In other words, these are electrons. Antioxidants are basically the rescuers in our body. They are there to save us, protect us against the oxidants. So every time there's an oxidant trying to damage or destroy the cells of our body, these antioxidants come for rescue, and they donate some of the electrons to these oxidants or the free radicals and kind of neutralize them and solve the problem there. So they basically scavenge these oxidants and they alkalize our body. Okay. So in the place of blood becoming extremely acidic, what happens when you have enough of antioxidants in your body is that your blood remains the way it is supposed to be, basically in a slight alkaline form. Basically, it means the blood remains in the normal pH. Okay. So as a result of which, again, it protects us against the oxidative damage, so we don't end up with degeneration, disease, or death, premature death. So basically, antioxidants is where you would experience optimal health. So this is how things happen. So here you see a normal cell, and then oxidants, as they just keep attacking these cells. Now what happens is the cell goes through degeneration, disease, and finally the cell may get damaged, and you may end up with uh, any problem. It may be an autoimmune disorder like rheumatoid arthritis, psoriasis, or ulcerative colitis, diabetes, blood pressure, or anything, or even cancer. uh, Anything could result from oxidative stress. Okay. So now the most interesting thing I want you to understand is that there are two things: oxidants, antioxidants. Antioxidants are something that should constantly flow into our system every single time you eat a food. Antioxidant is something that you should have surplus flow into your body. You may wonder what is the relation between an alkaline diet and antioxidant and all of these things. At the end of this webinar, you will have a clear understanding of what I want to share with you. So you have antioxidants, which is something that you should always seek out to. There should be a surplus flow of antioxidants into your system every time you eat or drink something. And on the other hand, you have these oxidants. You have to get rid of these oxidants. Now, unfortunately, each of us are bombarded with 10,000 oxidants every single day. Now, here's the list of oxidants. You may want to know what are these oxidants. Here are these oxidants. So in the form of food, hydrogenated oil, processed food, cell phone radiation, saturated fat, and even some of the supplements which we think is going to save us turn out to be oxidants. They are not actually working, but they are actually destroying our health. So room freshness. So a lot of these things which we think are not harming us, cosmetics, anxiety, junk food, every single thing, we are bombarded with 10,000 different oxidants every single day, guys. So when it comes to oxidants, you have to reduce the number of oxidants that you're exposed to on a daily basis. Okay, so two things you have to do. There should be a surplus flow of antioxidants into your body, and on the other hand, you just have to reduce the amount of oxidants you're exposed to. All right. Okay. Now, what do you see here? I just want someone to unmute and just answer. What do you see here?
This is completely nature's gift, pure water, good weather.
Wow. So we basically,
Simply.
any other answer? Awesome.
Yes,
Yes.
peace,
This is an amazing place where each of us would love to spend our time, right?
is being a calmness, peacefulness, happiness,
Right.
and serenity.
Right. Any other answer?
Pure water?
Pure water. Yes. I would just call
No
this
pollution.
It keeps your mind,
no pollution.
like
Yes.
slow
Yes.
paced.
More answers coming in.
Means it keeps you calm, it keeps you cool. Just looking at the water and looking at the greenery,
Right.
you feel refreshed.
Right. Exactly. So, yes, someone said, you know, a clear water, something that's not polluted, right? I would call it a clear stream of water, right? So, let's take a look at this one. What do you see here? What do you see here? Forget about the dead fish over here. What do you see here apart from the fish?
Weeds.
Pollution.
Algae.
Algae, weeds.
Yes, polluted water, right?
Yes.
Polluted water. So, what if I tell you our bloodstream actually resembles any one of these things? In fact, this particular image, most of us do have a bloodstream which resembles something like this. So, what does this mean? I'm just going to explain this now. So, here's a bloodstream. These are images taken from a microscope. Okay. So, these are red blood cells. Now, in a healthy environment where your blood's pH is maintained in a normal state, in a healthy state, your red blood cells just look like what you see on the left side image, where the red blood cells are completely spherical in shape and they are surrounded by negative charge and they are completely healthy. They have highest potential to carry a lot of nutrition in them, and they travel at a maximal speed in the bloodstream. Okay, there's no obstruction. They just stay as a distinct cell in the bloodstream and single cells in the bloodstream, and they just move through the bloodstream without any obstruction. Okay, so this is how a healthy red blood cell would look like. On the other side, on the right side, what you see is unhealthy red blood cells. Now, unhealthy red blood cells, they become like this when the blood's pH is kind of altered, when they are not at their optimal range. Uh, they just become something like this. The first thing to happen is they lose their negative charge and they are not capable enough to absorb nutrients to render to the cells. So they are trying to steal nutrients from each other and they are kind of clogged. They are just piled onto each other. They look like stacks of coin over there. And they are not moving through the bloodstream. They are stagnant in the bloodstream. So imagine if this is how the bloodstream is going to look like. These cells are literally starving for nutrients, and these cells are not receiving enough of nutrients. And as a result of which, DNA damage or cellular damage can result. Okay. So your bloodstream can either look like that clear stream of water, or it can look like a completely polluted water like the second image you saw here, like this. Okay, so now there are a lot of factors that can actually result in either the acidic pH or the alkaline pH. Now take a look at this video. This is again a video that I want you to watch. This is a difference between a normal blood flow and an obstructed acidic blood. Okay, so this is what we call as blood sludging. Now, what you're seeing here is a normal blood flow. So it's flowing like that clear stream of water without any obstruction. There's absolutely no problem. But take a look at this. So this is not an animated view or animated video or anything, but take a look at what happens immediately after a meal of high fat food. So, we all know that fat is something that's needed for our body, but they are fatty acids. We don't want them in excess. But when you take that, what happens is blood sludging. They kind of become sticky and they cannot move through the bloodstream the way they are supposed to. Okay. Now let's take a look at another video where there's a better view of the red blood cells and the white blood cells. Okay. Now, what you see here are red blood cells which are not moving at all through the bloodstream, okay? And they are completely unhealthy, and they typically look like stacks of coin over here. And in the bloodstream, you find a lot of other things over here. Now, those are the cholesterol pieces and uric acid crystals. So basically, the cholesterol and uric acid crystals and all of these things have made the blood more acidic. Now, this is a healthy blood. I mean, not completely healthy. They are still not single cells over here, but still they are way better than what we previously saw. And what you see here is the white blood cell. It is not so active because the blood is not so healthy for the white blood cell to do its job. So here again, we see some of the bacteria and all of these things. I want you to understand this, guys. So when the blood turns out to be unhealthy, or in other words, when the blood turns out to be acidic, it gives way for all the unwanted things to be in the blood. Or in other words, your blood turns out to be acidic only when all these unwanted stuff comes into your bloodstream, like the uric acid, excess amount of uric acid, excess amount of cholesterol, and sometimes you may have excess amount of calcium. And this would turn out to be a breeding hub for bacteria, virus, and all of these things, where your white blood cell is the one which is supposed to hunt down all of these bacteria, virus, and it is supposed to keep the bloodstream clean from cholesterol, uric acid crystals, and all of these. But unfortunately, because the blood is acidic, even the white blood cells are not so healthy. They are kind of inactive and dormant, and they are not doing their job, and they are just staying quiet like that. Okay, so that's why your blood needs to be really healthy. So, we all talk about high protein diet, and we all talk about omega-3 fatty acid in our food. We all talk about having vitamin C in our food as supplements sometimes. But how many of us really know antioxidants are really the most important thing to be in optimal health? See, now, again, when it comes to antioxidants, what most of us think is that antioxidants, okay, the one thing that comes to my mind is green tea. I consume green tea on a daily basis. So I'm getting my antioxidants every day. No, you're wrong. So antioxidant is a, vast subject. There's a lot that you have to know about antioxidants. Okay. So let's watch this video if possible. I'm not able to forward this video. Okay, I hope you understood about that. I just wanted to show this, the difference between the acidic blood, how an acidic blood would look like, the red blood cells in an acidic state and in a healthy state. Okay, now I told you about the pH. Now you know what is a normal pH and how the red blood cells would look like in a healthy environment and in an unhealthy environment. So every time your body turns out to be kind of acidic, there are two important organs of your body, though this information is not really important for our discussion today, but I just wanted to share this with you. Um, there are two organs of our body which are responsible to maintain the normal pH of our body. So every time your body kind of turns out to be acidic, there are two things that happen. One is there's an increased buildup of carbon dioxide in your body, and there's an increased buildup of hydrogen ion. So your body has to get rid of these two things, and there are these two organs which are responsible to, help you get rid of these things. One is the lungs, which help you to get rid of the carbon dioxide, and then you have the kidneys, which help you to get rid of the hydrogen ion. Okay, so now every time you just get exposed to these oxidants, you saw the big huge list of oxidants, right? And uh, we get exposed to a lot of these oxidants on a daily basis. So every time you get exposed to these oxidants, your pH kind of falls down to the acidic side, and as a result of which you could end up with a problem called metabolic acidosis or metabolic alkalosis. So metabolic acidosis is a state where your pH falls below 7.34, which is a normal value of your pH, right? So when your pH falls below the 7.34 range, it is called as metabolic acidosis, which is fatal, which is deadly. You could just end up with coma. Okay, but this is something that's very rare. Your body does not get into metabolic acidosis so easily. Okay, so the organs like lungs and kidneys take care of you. They try to maintain a normal pH no matter how much abuse you cause to your body. And then we have metabolic alkalosis, which is a condition that happens when your body's pH goes above 7.45 towards the alkaline side. So I want you to understand something here. Just by taking baking soda, or just by mixing baking soda with your lemon water and drinking, you're not going to increase your pH above 7.45. And there are a lot of these messages that circulate and which claims to increase your pH, but your pH is something that is supposed to be maintained with this within this narrow range. It cannot go above the normal value or below the normal value. Doesn't mean that higher value means better health. It actually causes some deadly problem like coma or anything like that. But I just want to turn your focus towards this last problem that I mentioned here, which is low grade metabolic acidosis. Low grade metabolic acidosis. Now, what is low grade metabolic acidosis means is this: your body is not actually getting into that so-called metabolic acidosis. It is slightly over that tipping point, and your body is constantly fighting to maintain that normal pH. Because there's so much abuse coming in on a daily basis, so your body is constantly fighting and fighting, which is where your body gets into this so-called low-grade metabolic acidosis with all the abuses that we cause. So suppose if you are exposed to a lot of oxidants, then you end up with, you are suffering from low grade metabolic acidosis. Suppose if you have enough of antioxidants and less of oxidants in your body, then you're not actually having this low grade metabolic acidosis, is what I want you to understand. Okay, now what actually causes the blood to become to hypercoagulate, or in other words, what actually causes the blood to suffer from that low grade metabolic acidosis? There are two kind of toxins in our body. One is the problem that happens right inside our body, which is called as the endogenous toxins. So which is a result of some of the imbalanced function of our body. Our body produces these toxins. Examples: uric acid. Elevated uric acid by itself is a toxin which could turn your blood into acidic. Or excess amount of cholesterol, which we already saw, which causes your blood to become acidic. An elevated sugar level in your blood, which can again cause your blood or your body to suffer from low grade metabolic acidosis. And then there's something very interesting called the increased level of calcium in the blood. And this is something most of you may be unaware of. Um, calcification is something that people suffer from. I'm going to discuss about that in a moment. Okay, so for now, I want you to know that there are endogenous toxins which your body produces, as a result of which your blood can turn out to be acidic. Okay. And then we have something called as exogenous toxins. Exogenous toxins are none other than the oxidants that you get from outside, like increased amount of coffee, tobacco, alcohol, sugar, and preserved food that we eat, and pesticides in our food, and heavy metals like mercury, aluminum, lead, cadmium, and medication, long-term medications, and a lot of supplements that we take. All of these things are called as the exogenous toxins, which means toxins that come from outside. But the most important thing which we are exposed to on a regular basis is a high fat, high protein, high sugar, and high salty food. Okay. Now, when we say fat, protein, sugar, and salt, all of these things are actually important. Salt is none other than some of the minerals that our body actually need. But what happens is we take all of these things in excess, and these food companies are well aware that we love salt, and so they have come up with the sodium chloride, which is what we call as the table salt, and we add enough of it to our food and we eat. And this high salty food can cause a problem. And again, high sugar. While sugar is the actual fuel, glucose is the actual fuel for our body does not need this refined and processed sugar. And again, when it comes to high protein, now when it comes to protein, in other words, we call as the amino acids. There are essential amino acids, but the they are acids basically. Though we need all of these things, we don't need increased amount of acids, which actually cause your blood to become acidic. And again, fat we call the fatty acids. Now, though there are essential fatty acids, we need fat, but we don't want them in excess. When you take them in excess, again, you increase the acid load in your body. Unfortunately, a lot of the diets that's circulating around people are following, they see some of these benefits and ignore the most important part of it, actually increase the acid load to their body, forgetting the fact that antioxidants are something that they are seriously missing out in their diet. Okay. So you now have an idea about the endogenous toxins and the exogenous toxins. Okay. Now, um, when your body suffers from the low grade metabolic acidosis, now there are some of the common problems that can result from that issue. Now, some of them that I've listed down is high BP, heart disease, osteoporosis, kidney stones, kidney disease, calcification, and even it can cause cancer. I'm just going to give you the pathophysiology, or what happens inside your body when your body gets into this low grade metabolic acidosis, and how all of these problems can result. Okay. Unfortunately, I don't have a slide to explain that, but I hope when I just explain it, you will understand that. So let's say you just get exposed to a lot of oxidants, or you just keep taking a lot of high fat food or high protein food, high sugary food, high salty food. Now, as a result, your body is switching over to this low grade metabolic acidosis. Now, how your body tries to maintain a normal pH here is that it tries to bring a lot of these minerals, stored minerals in various parts of your body, to neutralize this acidity and maintain that normal pH. One of the important minerals that is believed to neutralize this acidity is calcium. Okay, you all know where calcium is found in your body. Now, calcium, 99% of your calcium is found in your bone and in your teeth. So what your body does is to leach out the calcium from your bones and your teeth, making the bone weaker and your teeth weaker. And it brings this calcium into action to neutralize the acidity caused by all the abuse that you're exposed to. Now, once the calcium is used to neutralize the acidity, now the calcium is not replaced, and the calcium has to leave the body through the urine. Now, remember this, when calcium is leached out of your bone on a daily basis, it causes this problem called the osteoporosis. Osteoporosis simply means weak bones, right? So now where is the calcium from the bones? It is now in the kidney, because it after your body uses the calcium to neutralize the acid buffer. Now it is considered as waste calcium. It has to leave the body through the urine. Now, based on the abuse you cause, there's more calcium that's leached out. And based on the calcium that's leached out, this increased amount of waste calcium that reaches the kidney. But unfortunately, your kidney has got a limit to excrete the calcium out. So what it does is it just excretes a certain amount of calcium and leaves the remaining calcium in the kidney itself. So this calcium, which is not removed out of your kidney, can turn out to be stones. Okay. And if you just Google, or if you take any medical textbook and see what are the commonest stones, there are two stones. One is calcium oxalate stones, and the other one is uric acid crystals. Okay. So the calcium stones are what we call as the kidney stones. And because of this repeated abuse to the kidney, now there are tubules in your kidney, which are the filtering system of your kidney, which constantly keeps purifying your blood. When so much of abuse comes into the kidney, these tubules can get damaged, as a result of which you may end up with kidney disease. So now you know osteoporosis, you know kidney stones, and you know kidney disease that's being caused by the low-grade metabolic acidosis. Now, Now the next thing that happens is when there is low-grade metabolic acidosis, which means blood sludging, your red blood cells are kind of clogged onto each other. Now they are not moving through the bloodstream. So in the bloodstream, there's a pressure buildup, right? So there are, the blood vessels, the terminal ones, when they reach the cells, when they reach the brain, the terminal part of your blood vessels do have a diameter of just the size of a needle tip. So to pass through a capillary like this, your blood cells are supposed to be as single cells. If they are clogged onto each other, it is impossible for these cells to move through that, as a result of which you get increased amount of pressure buildup inside, which is what we call as hypertension or high blood pressure, right? So coming back to the kidney disease, when your kidney is trying to remove a lot of these calcium, and there's some of these calcium which are stored in the kidney itself, and they turn out to be kidney stones, and some get reabsorbed into the bloodstream. Okay. Now when they get reabsorbed into the bloodstream, because the kidney is not able to just excrete all of it, some of these calcium get reabsorbed into the bloodstream. And what happens is, now your body has to find a place where it can just safely dump these calcium. Okay. So it cannot be restored into the bones, but it just kind of tries to find a place where it can dump it. And I do come across a lot of these patients in my hospital where the calcium is deposited over their shoulder or over their heel, causing what is called as calcific tendinitis or calcific arthritis or heel pain or something like that. Okay. So the calcium can get deposited over there. And when this goes on for years after years after years, now what happens is the calcium can just deposit right inside the blood vessels, causing calcific uh, atherosclerosis, okay, which means blockage of an artery because of calcium. The diameter of the blood vessel by itself could be blocked, and cardiologists commonly come across these cases. So when we talk about the heart disease, 85%, stunning 85% of the heart disease are caused by the so-called calcific atherosclerosis. Okay. Now you see, we have covered pretty much all of it. Now, what about cancer? When there is so much of blood sludging, when there's so much of low-grade metabolic acidosis going on, your cells are not receiving enough of nutrients, enough of oxygen, As a result, they are about to get into cellular damage. Now, along with this cellular damage comes DNA damage. Okay, when the DNA is damaged, now DNA is something that has got the blueprint as to how your cells can multiply. So your DNA basically has got the control cell multiplication with them. Okay, so when the DNA is damaged, they lose their control over the cells, and the cells become, turn out to have what is called as uncontrolled cell multiplication, or what we call as proliferation of cells, and which is where your cells, there's an outburst of this growth of these cells in any part of your body, which is what we call as cancer. Okay, I hope you understand what a low grade metabolic acidosis can cause. Okay, now interestingly, there's a slide that I've not included. Now, this is not so much relevant to our topic, but I just want to add this important point here. Now, we are all on a pandemic. Now, if you just look at the statistics all around the world, one thing is so profound and clear, that people who suffer from all these diseases that I've listed here, high blood pressure, high heart disease, and kidney diseases, and cancer, diabetes, and all of these people are the ones who are at higher risk of suffering from COVID-19. Like, even if you just get infected by COVID-19, the chances of, you know, recovery is very poor in these cases. Why? Because your immune system is compromised. So, do you understand the connection between healthy living, healthy eating, and being protective against a pandemic like this? Right? So now let's move on to the most important thing, antioxidants. Now it is very clear antioxidants are the most important thing of our health. It is not the protein, though protein, fat, and all of these things are important, but antioxidants are the most important thing. They are the savior of health, I would say. So antioxidant content is basically measured using a scale called ORAC, oxygen radical absorbance capacity scale. Okay, now ORAC units that we all need on a daily basis. I told you we are exposed to like 10,000 different oxidants on a daily basis. So we need somewhere around 8,000 to 11,000 units of antioxidants every day. And the next thing is that we need wide range of antioxidants, not just the green tea, not just vitamin C supplements, but we need wide range of antioxidants from our food. Now, what are antioxidants? Antioxidants are none other than all the vitamins that we know act as antioxidants. Okay. And then we have what is called as plant chemicals. Like, you may have come across beta carotene, isoflavonoids, and each of the fruit, each of the vegetable, each of the leafy green that you know of do have a plant chemical in them. Okay, like broccoli do have something called sulforaphane, and there's something called lutein. So there's a wide range of phytochemicals or plant chemicals that these plants produce on a daily basis. So all of these plant chemicals are also antioxidants. Okay, so we need wide range of antioxidants, and we need 8,000 to 11,000 units of these antioxidants on a daily basis. So ORAC values tend to be highest in actually spices. I interestingly came across a video of a keto proponent who talks about you don't need to eat fruits and vegetables to get your antioxidants. In fact, spices are the ones to have the highest amount of antioxidant, which is true. Spices do have the highest amount of antioxidants. That's true. But the values that are given for these spices are in 100 grams. Is it possible for you to have 100 grams of these spices? While these spices are okay to have in small quantity, a lot of these spices can just destroy your mucous membrane, which by itself could result in adverse effects. So you don't want so much of spices. What we are naturally designed to eat is a lot of fruits and vegetables, like every time you have good amount of fruits and vegetables in your diet, and you have enough of these antioxidant that units that you get for the day. So lower for highly processed grains and non-plant-based food. Okay, so antioxidants are like when a food is processed, even the grains are processed. Grains and pulses do have antioxidants, but what we get is like in a flour form, right? They don't have much of antioxidants, unfortunately. And what about the non-vegetarian food? Do they have antioxidant? To all non-vegetarian food, you may just go anywhere and search. Uh, the fruits, vegetables, and leafy greens do have 64 times more antioxidants than any of these animal-based food. If you have to get this 8,000 to 11,000 units of antioxidant, the daily requirement of antioxidant for your body, then through non-vegetarian food, you may have to eat 5 to 10 kgs of meat every day to get that. Okay, and you cannot compensate that with spices either. So your weight loss does not directly translate to good health. Please understand that. All right, so now here's a study, and it is this study that talks about the plant-based food having the highest amount of antioxidant. So they just tested the antioxidant level of 3,100 different food. And interestingly, what they found is that even Snicker bar has got 4 times more antioxidant than non-vegetarian food. That does not mean you should go for Snicker bar. You get a lot of antioxidants from fruits, vegetables, and leafy greens. All right. Okay, now here's the list of food that has got the highest amount of antioxidants. So prunes, and maybe if required, I can share the slide, or if you're watching this, you may just take a picture of this slide. And prunes, raisins, blueberries, blackberries. So as you see, a lot of these berries are in the list. One thing that I did not actually add here, which is the cheapest of all of these things, that is believed to have like 10, 15 times more antioxidants than a lot of these berries, is the Indian gooseberry. How many of us take it on a daily basis? Just one berry has got some 7 to 8 times of the antioxidants of these blueberries, blackberries, and strawberries, which are really expensive. But that doesn't mean you have to eat gooseberries, Indian gooseberries, on a daily basis. As I told you earlier, we need varieties of antioxidants in our food. So, but it would be a great idea to include gooseberries on a daily basis. All right. So then we have these veggies: kale, spinach, cabbage, broccoli, beets, bell pepper, corn, eggplant, beans, moringa, and amaranth and carrot. So all of these things are again believed to have the highest amount of antioxidants. So antioxidant and fiber-rich food. Okay, so you may ask, I cannot eat all of these fruits and vegetables. Don't ask me to eat all of these fruits and vegetables. Can I go for supplements? Now, the problem with supplements is that there are a handful of research that clearly tells us that through supplements, you don't get the real benefit of antioxidants. Okay. In fact, when beta carotene was taken as supplement, it causes cancer, is what the research says. That's really shocking. So you need to eat the whole food, and you need to get it from the real source. Okay. So fruits, vegetables, and leafy greens are the way to go if you really want to have surplus flow of antioxidants into your body. All right. And then, as I told you earlier, what are the food that have got less amount of antioxidants? Everything that you need. I'm not saying you have to completely stop eating all of these. You may eat it, but mindfully. And antioxidant should be your goal. Okay, guys. So I've come to the end of our webinar today. So every single time you eat your food or drink something, you're either feeding your disease or fighting it. Just think about a cricket match. You know, every single ball that the batsman faces, they have to try to get the maximum score out of that ball. And that should be our goal as well. Every single time you eat your food, your goal should be to provide sufficient amount of antioxidants to your body. All right. So just by indulging on anything and everything that satisfies your tongue, what you do is you're feeding your body with the disease causing oxidants. Okay. And you're not just providing your body the enough of antioxidant. Let me tell you this, even if you're suffering from a fall, and as a result of which you may just suffer from a shoulder injury or a knee injury, which is not getting better. And to get better, you know what your body is looking for? A good reserve of antioxidants. It is this antioxidant that your body uses as repairing material to fix your shoulder problem or the knee problem or the diabetes or hypertension or whatever it is. Okay. Antioxidants is the way to go. So let this be your goal and include enough of antioxidants in your food. So that's it from me. And uh, maybe if you have any questions, you may ask me right now.
Yeah, quick one, Jerold. Pandemic. Okay, related to the current pandemic, there are some of us, I mean, some amongst us who have already been affected by it. Some of us who are like kind of, trying to protect ourselves from it. Now, what kind of a diet? I mean, I'm just like, normally the women folk look forward to seeing what is that they should be eating on a day-to-day basis as a regular regimen so that they can hold them, their children especially, and people who have a problem at home, more immune to the current pandemic. So if you could just suggest us what, on a day, it's an Indian thing that, I mean, you can't keep eating cherries and berries all through the day, especially for people who are in India where the supply is a lot less and more costly.
Yeah. What I would suggest is that, you may be living in India or in Dubai or any part of the world. There are seasonal fruits and the fruits and vegetables that you just get from your local farmers and whatever is available there. As I mentioned earlier, varieties of fruits and vegetables is the way to go. And you may just simply go with whatever fruits, whatever vegetables is available and leafy greens. If you don't get any of these leafy greens, it doesn't have to be kale leaves and it doesn't have to be the iceberg lettuce leaves or anything like that. It can be a simple moringa that you get from our own garden, or it may be as simple as amaranth greens that we get just for 1 or 2 rupees. I mean, I don't know how much exactly in India, must be 15, 20 rupees. So here we get it for, like, here again, we get parsley, spinach, and all of these things for a much lesser cost. Even I personally don't go for a lot of these berries on a daily basis, but varieties is the way to go. And just list down what are the fruits that are available. And I would suggest that 7 days, 7 different varieties of fruits, and 7 days, 7 different varieties of greens if possible. Or if it's just 3 or 4 different greens that's available locally, then just keep switching. Again, vegetables, different kind of vegetables on a daily basis. So varieties is the key. And so fruits and vegetables available locally should do the job.
Thank you.
Yes.
Gerald, Gerald, I have a question.
Yes.
Is uh, is COVID get impacted to all diabetic patients or case to case?
Well, all diabetic patients are at increased risk of being infected by COVID-19,
Okay.
simply because when you
Mm.
suffer from diabetes
Mm.
or blood pressure or heart disease or any of these so-called lifestyle disorder,
Okay.
your immune system is compromised. Two things that compromises your immune system is the disease itself, and
Mm.
the second thing, the medications that you take, the long-term medications that you take. Both of
Okay.
these things have kind of suppressed the immune system. and you are at increased risk of being infected with COVID-19.
Okay, because I just asked you this
Gerald,
question because I just came out from COVID positive. Now I'm negative.
Yeah.
Okay, but for me, I did not get much impacted. That's it.
Okay.
That's what I asked you.
Yeah, definitely it is different from case to case. And
Mhm.
what we see all around the world is like actually the recovery rate is quite high.
Okay.
So one doesn't have to be really worried. And now that you all have watched this webinar and you can just completely take control of your health is my belief. And even if you can just start doing from today, 10 days from now, you will see positive changes in your health is my belief. So
I,
we really don't have to panic, and as we just take all the normal precautions like social distancing and hand washing and all of these things. In addition to that, something that's really powerful is the your immune system, improving your immune system. Your immune system being in a position to fight any disease is what that can protect you is what I believe.
Okay, one who got COVID
Hmm.
again after what interval he will again get it?
That again depends on how good your health is. Actually, like in addition to your immune system working effectively, now once you get infected, you get that natural immunity as well. So you are better off, and you really don't have to be worried if you can just take good control of your health, and don't panic that you're just going to get it again. Healthy living takes care of it.
Okay, thank you,
hi,
Jerold.
Gerald.
Ge-
Gerald, I have a question.
Yes,
How are you?
yes, I'm good. Thank you so much for coming.
Yeah, I really enjoyed your session. It was very insightful and crystal clear. You were mentioning about the alkaline and acidic pH and in the blood. Now, for people like diabetes who are on medication for a very long time, what advice do you have? Because I've been trying to get out of medication,
Yeah,
and I am having food. But what I've noticed, like people can say protein, you need protein, because but I try to avoid whatever I can, meat or egg and milk and all the and even yogurt. um, how do um, see the medications that you take also affects your um, anxiety and other issues you have because of the medications. And how do you balance that? How do you control your medications, or how do you get out of it? Because you say long term medication causes acidity. This is one question. Second question is, I have a friend out here whose mother is only 55 years old, and she's diagnosed with cancer, intestinal cancer. So I asked him, do you want to get in contact? But this person is only going to help you through the diet. Are you ready for it? So he says, just tell me what is. I said, you need to eat fruits and vegetables. But then after 2 weeks, he said his mother is following that, but she gets very stressed, because you were mentioning about stress factor also. She is a very some people's nature are like that. They get highly stressed when certain situation arises. What has happened to her is, after 2 weeks her cancer became very aggressive, and now they are just waiting to give her the best of days, because the doctor has given her hardly 2 months to live. So I still told him, do you, I mean, there is hope. I said, do you want to know? He says, no, we have taken to the best of doctors, and this is what they have said. All of them have said this. So then I had nothing else to tell him. But it's really a sad state to see that people give up, even though the doctors say. And about the COVID, that's the second question. Now the third question is about the COVID. me being so diabetic with my the 3 months of glucose level may be around 8 or 9 or even 12. I really don't know because it's been long time, but I have been walking in and out and going and meeting people, and I don't really cover my mouth because I find it very difficult to breathe with the mask on. But I don't step outside the premises of where I live. But I have in and out laborers coming and doing work. But just a question, like, is this COVID so dangerous? Because I have never really taken precautions. But of course, cleanliness and hygiene is definitely there. But I'm wondering, how can healthy people get it, and how come people like me, who have not been, God forbid, I don't want to have it, but I'm just being just want to know why I haven't been affected when I'm so careless.
Okay. Okay, let me try to answer all your questions. The first thing is like how to get rid of diabetes through the diet and how to get rid of these medications. Um, well, that by itself is a different session altogether.
I got it. I got it.
Yeah,
It's fasting.
I don't recommend stopping your medications right away. You have to be on your medications, and it requires so much of commitment. When you just today, in fact, what we discussed is just about antioxidants. The other important thing, just like that of antioxidants, is
Mm.
the fiber in your food. The
Oh,
fiber in
okay.
your food literally
Mm.
works like a mopping stick. When
Mm.
we spoke about the endogenous toxins like the elevated uric acid, elevated
Yeah,
hormonal
yeah.
level, you may
Mm.
suffer from elevated estrogen or
Yeah, yeah, yeah.
hormonal imbalances and all of these.
Mm.
So in a case like that, what happens is that your fiber actually does the job, especially in the case of diabetes. Fiber combined with antioxidants does the magic. But it requires so much commitment. Like normally, when I just put my patients on a diet, what happens is that I put them through a transition phase where they make small changes every day. They may just stick to 5 to 10% of change for first week, or 25% of change in the first week and 50% the next week, and slowly and gradually you move into the diet, not jumping into the diet right away. So it turns out to be a sustainable form of a diet. And then you reach a point where you give your 100%. So
Okay.
this, when you just start giving your 100%, so you
Mm.
have to stick to it, no matter how much your family is tempting you to eat
Mm.
other unhealthy food. You have to
Mm.
stick to it. Believe me, when you
Mm.
stick to a 100% plant-based diet with
Mm.
completely whole food and
Mm.
less of refined and processed food, and
Mm.
when you do that, the results are really amazing. The results are really amazing, and it's clearly documented. These are not my own words. There are researchers that where these pioneers of plant-based diet have clearly documented that this can
Yes,
do
yes,
wonders. Okay, so you
yes.
have to reach a point where you give your 100%, and
Mm.
this phase I call the disease reversal phase, which may go on for
Mm.
even up to 1 year, and
Okay.
that depends on the degree of damage caused by the disease. So, in order to
Okay.
reverse that years of damage, you
Mm.
may have to get into this diet and just follow this diet for about even 1 year or 2 years. And this is not a diet, this is a lifestyle basically. And after this phase comes what is called as a maintenance phase. Now, during
Mm.
the maintenance phase, what you do is like you may just little bit of whatever you want to eat, like
Mm.
5% of things that you really want to eat can be taken,
Mm.
but still
Mm.
you would stick to this 90-95% of a whole food plant-based diet where
Mm.
you fill your body with good amount of fiber and
Mm.
enough of antioxidants in it. So that way you can just maintain this health which you have regained from that disease.
Yeah,
So this,
I think there's one more thing also, because you were talking about the blood being sluggish. I think for diabetes, being oil free also, that also has to be
yeah, when I
implemented.
say whole food plant-based diet,
Yeah,
that's what it means, and it's a vast topic. I'm not just
yeah, I
mentioning
got it. Yeah, I
everything.
got it.
So
Okay,
that answers your question number one. Okay, and
okay. Hmm.
then your second question is about what? Uh,
The person who having cancer.
okay, about cancer. So
Hmm.
in the case of cancer, what I want you to understand is, like, even
Hmm.
when a person begins to see a tumor,
Hmm.
uh, the cancer actually has started some 10-15 years back. And
Oh.
tumor is
Hmm.
something like stage one, which is what we call a stage one. So you see a tumor in some part of the body, which is
Hmm.
stage one. Even for stage one to be seen, it takes like 15 years. So there's so much of low grade metabolic acidosis. The body has been on low grade metabolic acidosis, cellular damage, and DNA damage, which are things that you cannot diagnose or understand through any of these things, any of
Hmm.
the investigative measures. And so it takes like such a long period for someone to develop even the stage one cancer. And
Oh
imagine
my
stage
goodness.
four
Yeah.
cancer, where the cancer has metastasized to distant
Hmm.
organs. And
Yeah.
when the doctor says tumors,
Hmm.
so many organs have been affected.
Oh
So,
my
you know,
goodness. Okay.
having not seen the person, I wouldn't promise that this diet is going to do a magic over there. That would be,
Hmm.
a
Hmm.
false promise. And but there are doctors around the world who do what is called as a therapeutic antioxidant treatment. So if they come across someone like that, they may just reach out to them, but that's really, really expensive.
Hmm.
So that could be one of the options in a stage like this. Okay, so
Hmm.
that answers your question number two. And question
Hmm.
number three, COVID-19.
Hmm.
Now, think about some 5 or 10 people crossing the highways every single day and going to
Hmm.
their work. And
Hmm.
one person is hit by a vehicle someday. And does
Hmm.
that mean crossing the highways every single day is fine? Or
Hmm. Hmm.
they have to avoid doing it?
Hmm.
So your case is like that. You are just lucky that you did not get infected. That doesn't
Hmm.
mean you can be like that forever.
Hmm.
So, in fact, every single day we get new information about the disease. So, there
Hmm.
was a point where they said mask is meant for medical professionals only. And then
Hmm.
WHO said mask is something that everyone should wear. And that's what Dubai Health Authority or everyone is saying. And we are all following it because we are still learning about the disease every single day. So whatever precaution is instructed, whatever is expected of us to follow, let's follow it. And
Gerald, wearing mask again, that your pH blood level also will get altered, no, because you're breathing your
true,
same carbon dioxide.
very true, very true. But I told you antioxidants are your saviors. Anyways, we eat 3 times of food every day, at least minimum of 3 times. Some of us eat 5 times. So make use of these 3 to 5 times of your food to compensate for all of these things is what I would recommend. Yes, there
Hmm.
are a lot of advantages, pros and cons to this particular advisor that's given to us. But I think while we follow it and we just give importance to the healthy diet as well.
Hmm.
So that's how I believe you got the answer for all three questions.
Thank you,
Sunita,
thank you, thank you, thank you.
Sunita wants to ask you something.
Sorry.
Sunita
Gerald.
wants, Sunita D'Souza.
Yeah.
Hi. Hey, Gerald. Hi.
Hi, Sunita.
Hi. A quick question. I want you mentioned about amla, Okay.
Yeah.
And it's one of my favorite. How do you normally take it? I generally just take it raw, with a little salt. I mean, is that the best way to do it, or is that in a shot or in a smoothie, or how do you?
Yeah.
One
You
more
know,
point to add on this. At the same time, I have heard this gooseberry when you take daily, it leads to constipation. Is there anything like that? Just to add on the same.
well, okay. First of all, let me answer Sunita. Sunita, what I believe is whatever form of food we take, it has to be more close to its natural state. What is the most natural state of gooseberry that we can take is to just bite and chew it and eat.
Yes, true.
A- And the next possible way to take it would be smoothie or juicing it and taking it. And of course, there are so many other ways people take it, pickling it and powdering it, gooseberry powder or gooseberry supplements. So, the more closer it is to the natural
Nature.
form, the better it
Absolutely.
is. Okay.
And what's your take on all this acai berry and all these ones which we are not, which is a Brazilian superfood? Is that necessary to take? The
Which,
acai, which has
which,
become
which,
like craze now.
which definitely may have some form of antioxidant in them, like phytochemical in them, or a vitamin, a particular vitamin which may be at a higher level. But not any one of these berries is going to be a lifesaver. Like I told you, we need varieties in our food. There's nothing wrong in including it, but just relying on those berries alone may not be a great idea.
And when do you
Uh,
normally take them? In the morning?
Any time of the day should be fine. But when you take raw food, if it can be an exclusive raw meal,
Yeah,
you may just get better benefit of it, is my belief.
perfect. Thanks,
Gerald,
Jacob.
Yeah.
Gerald, I have
Uh,
one more,
um,
yeah, one more thing to add.
before
Anit,
you ask a question, I'll
it's
answer.
it's not a
With,
question. It's not a question.
hmm.
Anita has said about India, about whether we would get foods other than berries. I have just discovered that India has so much of, because of this COVID, India has so much of food that I haven't seen in Dubai. Over here, we have organic food shops opened, organic shops and different nooks and corners of even cities and towns where you were talking about sugar. They have something called the jaggery, which has added minerals. And me being diabetic, sometimes I take, because those jaggeries have iron content, because I suffer from iron deficiency. And about the berries also that you say, the papaya, the seasonal fruits, you were talking about the seasonal fruits, the papaya, the pineapples, the chiku, the custard apple. There are so much of varieties out here that people think that India doesn't have. But in each state, be it Tamil Nadu, Delhi, or Bombay, or Kerala, we do have seasonal fruits, and people are very much aware about what's happening, and they are having healthy food. My dad, who's 84 years old, this amla gooseberry, he buys them and he grinds them with ginger, and they have you have organic honey also. Mix it, and he has that every day, 1 spoon. So people are very much aware of it. And if an 84-year-old my dad, who goes about doing shopping, driving car, going out, coming in, by God's grace, he's not got COVID. So I said immunity does play a major factor. And India, believe me and trust me, you have everything out here, which you will be surprised to know that there are some things that you don't see in the GCC. People are very much aware out here. Even the food, you were talking about the high fiber food. And there's a rice, it's called nyavara ari. It's high 50% fiber. This is a rice that I eat, and I get it out here. And you
The
cannot eat
basmati.
yeah,
So
yeah, yeah.
for guys who are living in India, I think you may just find out. You may reach out to Sister Jessie as well if she lives in Kerala. and you may just ask her, or you may just do your own research to find out where you can get all of these stuff. And to answer your question, Rajalakshmi, you asked me if eating a lot of gooseberry would cause constipation. I haven't come across any such information. And two reasons why gooseberry can just do the opposite. If you're constipated, it can just help and work as a laxative, is because gooseberry has got a high level of vitamin C, which is a laxative. Vitamin C in high amount can work as a laxative. And the next thing is gooseberry is also rich in fiber, and the fiber is like real great fiber. So fiber also works as a laxative. A lot of these laxative supplements that you see out there are made of these fiber, flaxseed fiber or psyllium fiber, and things like that. So gooseberry has also got a good amount of fiber, and which can just work as a laxative. So I don't think it would cause constipation. And sometimes, what happens is you may have taken gooseberry, and all throughout the day, people may take a lot of other unhealthy food for which gooseberry may not be a compensation. But we tend to believe gooseberry caused it, but it may be coincidentally something else which caused the constipation and not gooseberry. I don't think gooseberry can cause constipation for sure. Any other question, guys? Okay. Anita, looks like
Thank you, Jerold.
welcome. Welcome. Thank you so much to everyone for joining, and it was a great session. Every time I share something like this, I'm motivated to follow it all the more. So this day has given me that experience once again. I may just reach out to food which has got a lot of antioxidants, and I will just eat it. So we'll have more sessions where we all motivate each other to just stick to healthy habits.
Thank you, Jerold. You're always motivating.
Pleasure. Thank you so much for joining.
Thank you, everyone, on behalf of New Start Toastmasters. Really, thank you. I think we just take using opportunities where we can tag in Rope and Jerold, Dr. Jerold, to tell us more about how we can take health as a serious thing, and of course, play with all the vegetables and fruits that we get locally. And also, yeah, balcony gardening, producing it in your own homes. That's what we are all looking at. So very soon, I think we should come back with something on microgreens. Sunita D'Souza would be interested, I'm sure, and most of us out there. So
Very true. Very true.
yeah, so let's keep this on. And yes, as Gerald said, every time we talk about it, we get more encouraged to start using these tips and tricks to increase our immunity. Thank you so much, Gerald. And anything, I think Gerald is just a message away for whatever consultation or other things that you need. With that, I think we come to the end of this particular health talk on the pH value of a body. Yeah. And I hope you understood that it's not tending more towards alkaline or more towards acidic. We all need to be there at 7, not below or above. So say a little goodbye to a small goodbye to all the junk, to all the animal based protein, and a very big hi to all that is live, that is plant based food. So with that note, Gerald, anything more to add to this?
That's it. That's it. Yeah, we'll be having a lot of these webinars, and our president, Toastmaster Anita, will host it. And she just came up with this beautiful initiative, and we'll be just sending out notification to all of you. There are a lot of these health series coming up, and please don't forget to join. And there's a lot of other experts who are just
Yes,
joining, and they're just going to share their knowledge with you.
very much. Thank you so much, folks. Good night. Have a nice
Good
weekend.
night. Thank
Take
you, Anita. Thank you, Gerald.
Good night.
Good
Thank you.
night.